Hello viewers and my dear students, especially third year student, I Dr. Megha Choudhary welcome you all in my surgery online class, and today topic of discussion is Pagets disease of the breast, also known as Pagets disease of the nipple. So in a simple language we can define it as a underlying invasive ductal carcinoma. So it is a type of breast cancer. It is a type of rare breast cancer, and it manifests as a clinical features like redness, scaling and flaking of nipple and areola. So in this picture you can easily see that there is eczematous eruptions formed in areola and around the nipple. So Pagets disease is a rare form of breast cancer, and the cancer usually affects the ducts of the nipple first, that is the milk duct, milk carrying tubes, that are the lactiferous ducts. Then gradually this cancerous cells spreads to the nipple surface and the areola, that is the dark circle of the skin around the nipple. The nipple and areola often become scaly, red, itchy and irritated. So जो कैंसरस सेल्स हैं वो पहले लैक्टिफेरस डक्ट्स में आए हैं, देन लैक्टिफेरस डक्ट से दे मूव टू द सुपरफिशियल स्किन इन द निपल एंड द एरोला. Now Pagets disease of the breast, the other names are Pagets disease of the breast and the Pagets disease of the nipple. So both are the same thing. So don't get confused if the question comes as a Pagets disease of the nipple or Pagets disease of the breast. So both are the same. Now what is the pathology, the pathophysiology behind this? This Paget disease of the breast is characterized by formation of Paget cells. So these are the special type of cells. These Paget cells are large cells with clear cytoplasm, that is the clear halo, and eccentric hyperchromic nuclei found throughout the epidermis. So epidermis gets disturbed. जो एपिडर्मिस है वो डिस्टर्ब्ड हो गया, वहाँ पे पैगेट सेल्स हो गए हैं बहुत सारे. पैगेट सेल्स क्या हैं? These are not the normal cells. These are the large cells with the clear cytoplasm. Now, according to the migratory theory, ductal carcinoma in situ cells migrate into the lactiferous sinuses and the nipple skin. Cancer cells disturb the normal epithelium barrier and extracellular fluid accumulates on the surface of the skin, resulting in the crusting of the areola skin. So that's how the epithelial is disturbed, because there is accumulation of extracellular fluid which results in formation of crust in the areola and the nipple. So in clinical manifestations you can see the features, the symptoms like flaky or scaly skin on the nipple. There is formation of crust and skin gets hardened, and there is eczema on the nipple and areola on both the areas with itching, redness and burning and tingling sensation. There is straw colored or bloody nipple discharge. A flattened or turned in inverted nipple, this is the characteristic feature. Then there is thickening of the skin on the breast and nipple is inverted. So this is the characteristic, very main and important feature, that nipple is inverted. And eczema like scaly patches are formed on the breast, especially on the areola and nipple. Now Pagets disease causes the skin on and around nipple to become red, sore and flaky or scaly. Then itching, tingling and burning sensations are the very important manifestations with pain and sensitivity. Scaling and thickening of the skin occurs. There is flattening of the nipple with yellowish or bloody discharge from the nipple. So discharges are also very important feature in Pagets disease of the breast. Because Pagets disease of the nipple is rare, so doctor often mistakes it for eczema. So in differential diagnosis it becomes very difficult to diagnose and to differentiate it with the eczema or the case of melanoma or tuberculosis, because these all conditions manifest almost the same type of symptoms. So you have to diagnose लाइक बर्निंग सेंसेशंस हैं, डिस्चार्ज है, इन्वर्टेड निप्पल है. Then for examinations, you have to recommend patient for the mammogram that will check the nipple area and will investigate the area of the breast. अगर कोई कैंसर तो नहीं है, कैंसरस ग्रोथ तो नहीं है. Then physical examination of the breast is must to look out for any lump or mass in the breast. Ultrasound and breast MRI to create additional images of the breast and check for other areas of cancer. Breast biopsy is done by taking the breast tissue and that gets investigated under the microscope. Beside that, the discharges from the nipple are also investigated. In treatment, first lumpectomy is done where the affected areola and nipple is removed, and if the entire breast is affected, then the process mastectomy is done where the whole breast is removed. In radiotherapy, high energy radiations are given to kill the cancerous cells. Besides this, chemotherapy is also very good and hormonal therapy is also given.